Hello Pilates lovers, welcome back to my channel, Annie Pilates Physical Therapist. This video is about Pilates for hip pain. It's about a simple stretching and strengthening program that we can do to keep our hips stable and strong. So get your mat ready and join me and Mr. Abel. So let's discuss the anatomy of the hip. It's the joint between the thigh bone and the pelvis, also the area adjacent to this joint. The hip joint is a ball and socket joint, so it means it moves a lot for rotation and movement. And when you're having hip arthritis and these muscles, such as your iliopsoas, the adductors, and your tensor fascia gets really tight, even your quadriceps. So if you're having pain and you can't walk anymore, please see a doctor. And the signs and symptoms of this is difficulty walking and painful. So let's discuss about the muscles that we're gonna stretch today. So it's gonna be iliopsoas, the pectineus, the adductor longus, the tensor fascia latae, and strengthening your gluteus medius muscle. The first exercise is simple stretching, knee to chest, little bit oscillation in your area to warm up. Start with the right. We'll do 10 small rocking motions up and down. Take a deep breath up and blow. Inhale and blow. You feel a lovely stretch, feeling it all the way to your hip, closer to your chest. Take a deep breath and blow. 7, 8, 9, and 10. So that's the right, and now we'll do the left. My recommendation is to do this up to 10 repetitions in each leg. So you take a deep breath, inhale, small rocking motion. So inhale and blow. Pull. 5, 6, 7, 8, 9, 10. So this is a nice warm-up to start with. After doing 10 times on each leg, then you hug both knees to chest and bend forward, and you feel a little bit stretch. You take a deep breath. 1, we'll do 10 times. Rocking up. 2, pull your belly button in and engage your core muscles. 3, inhale through your nose and blow. 4, 5, a lovely stretch. 6, inhale. 7, 8, 9, 10. So it's recommended to do this up to 10 times. So if you're having hip osteoarthritis, it is a nice way to start your stretch. The third one is bridging. So you lift, making sure your heels are on the mat without tiptoeing. So if you're tiptoeing, you're not really targeting your gluteus muscles. So always keep your feet down on your mat. So lift, you feel a lovely stretch on your hip. Then you slowly go down one vertebrae at a time. So you're strengthening your glutes. So it helps protect your hip joint. So take a deep breath. Then you slowly go down one vertebrae at a time. So my recommendation is to do this up to 10 times. So you take a deep breath through your nose and blow through your mouth. Then slowly go down one vertebrae at a time. You take a deep breath up, belly button in, squeeze your glutes, targeting your hip muscles. Then you slowly go down one vertebrae. Take a deep breath up, belly button in, squeeze as hard as you can. Then slowly go down one vertebrae at a time. The next one is butterfly with the hips and knees parallel to the mat. Then you will slowly separate your knees apart. You feel a lovely stretch on the hip groin area. You feel a lovely stretch on your hip. If you can't go all the way down, it's fine, because if you're having hip pain, you might be limited. So you go back to the center, then you take a deep breath, separate, take a deep breath, blow to your mouth, belly button in, and then go back. Take a deep breath through your nose, inhale, belly button in, then slowly go back to the center. And my recommendation is to do this up to 10 times as well. So you take a deep breath through your nose, blow through your mouth, belly button in. The next one is you're gonna bend your knee to tabletop, and then you're gonna turn side to side, then internal rotation. Usually internal rotation is harder. You're gonna have some hip pain, so making sure you're not rocking your hips as you internally rotate and your foot is out and your knees are still parallel to the hip, and back to the center and out. So do this up to 10 times. And back to the center and out. Inhale and then blow. Inhale and blow. Inhale and blow. So on your left leg, turn, external rotate, and then internal rotate. With most people it's difficult. Take a deep breath and then blow. Inhale, external rotate, and then turn outward with your foot. Inhale, turn your foot in, then out. So do that up to 10 times. The next one is lying on your side. We'll do clamshell. This is a very popular exercise, but most error on doing this. They don't keep their feet together. When they're lifting it, they're keeping your feet together without twisting your spine. It's a big no-no. So make sure when you lift your feet together, pelvis is in the center without twisting. So you take a deep breath, open, inhale through your nose, belly button in, squeeze your core muscles, then blow back. So it's recommended up to 10 times. Take a deep breath, belly button in, open. You feel a lovely stretch on your core area, targeting your gluteus medius. It's a muscle that gets really weak. Okay, the next one is we're going to be side lying again, and internal rotation, twist, lifting your foot, and then open your knee like a clamshell, but lifting your foot up. It's a side lying, so twist your hip down, knee pointing down the mat. Then you slowly lift your knee up with your foot down, but not touching your feet this time. So it's almost a clamshell position, but with your feet up. I know earlier I said that don't do clamshell with your feet apart, but this time it's a different kind of exercise. There's more range of motion going on to your hip. 10 times doing this is my recommendation. It's a slow progression. And if this is too difficult, then just continue with clamshell. It takes time to have this control on this hip joint. So you're also targeting your hip internal rotators and external rotators. Now we're going to progress. We're going to pull back to extension, and this has more stretch on your hip flexors, your iliopsoas muscles. So in this position, you feel a burn on your hip flexors, and then in this position, we're going to do some internal rotation again with your foot up, and then slowly external rotate with your foot down, targeting deep, small muscles of your hip. So we're going to do external rotation while in hip extension to stretch your hip flexors, such as your deep iliopsoas muscles. Still engaging your core muscles in so you won't twist your spine. So take a deep breath and blow. Internal rotation, toes up, pointing to the ceiling and out. So take a deep breath. Okay, we're almost done on this one. The next one we're going to tackle is leg lifts on side lying. So one more, and slowly go down and rest. So this is the fourth progression on the internal external. Is we're going further on the mat. So I'm touching, stabilizing on my knee and hip where I'm lying down, and my knee is pressing on the mat. And then we're gonna lift back all the way and then down. So you take a deep breath, lift further back to target your glutes medius, and down blow. Inhale through your nose, lift as high as you can. If you can't do this yet, it's fine. And if you're having back pain, then stop. Sometimes there's a correlation of hip pain and low back pain. Take a deep breath, lift, keeping your heels up and toes pointing down the mat. Then take a deep breath and lift as high as you can. So do this up to 10 times as well. So right now, I'm targeting the left side. And another one is the obturator internus. So pushing down with your left side, we're targeting the one underneath, and you're gonna lift. So when you do this, sometimes you're limited and it's hard to lift it because it's tight. So the obturator internus is a deep external rotator. At the same time, it's part of your pelvic floor. So you take a deep breath, belly button in, and my recommendation is do this up to 50 times. So you're gonna lift and down, lift and down, pushing with this leg down your foot to stabilize. So it's a boomerang shape underneath from your lesser foramen, and it wraps around to your glutes behind it and inserts on your greater trochanter. So it's a deep muscle that gets really tight. So when you loosen this up, it helps your hip mobility. So we'll do this up to 50 times as your homework, and up to 3 sets. So that's almost 150 times. Because it's a small muscle, it's difficult to strengthen. You need a lot of repetitions. So every time you lift, you take a deep breath and down blow. And you do that on both hips to balance your hip. And the next one, you're gonna lie on your stomach, and you're gonna do some bend, double knee bend. Sometimes you're limited because of quadriceps tightness, and then separate your feet apart and back. So sometimes you feel a pain on your sacrum if you have some tailbone pain. But if you can tolerate, this is a great exercise to open your hips. So take a deep breath through your nose and blow, and back to the center. So inhale through your nose and back to the center. Inhale, open and blow. Open and blow. Take deep breaths and blow. So my recommendation is 10 repetitions, 3 sets. And now we're cooling down from simple stretching. You can do some child pose. When you do child pose, it helps stretch your hip and your low back. If you're having knee pain, then stop. If you're having knee arthritis as well, don't do this exercise. And after the child pose, you can progress to frog stretch. So you separate your knees away from the mat, and then you slowly go down and you feel a lovely stretch on your hip groin area. So you take a deep breath through your nose and stretch it out and blow. And hold this up to 30 seconds. Do it 10 repetitions. So that's a nice stretch for your hip area. And then slowly go down again. Love stretch. Has a nice ending on how to strengthen and stretch our hip muscles if you're having hip pain and weakness. Thanks again for watching me and Mr. Abel on some simple, lovely Pilates exercises. Please like and subscribe to my channel. Ring the notification bell for future updates just like this one. I upload videos every Wednesdays for physical therapy, Fridays for 1 hour, advanced Pilates, and Sunday for beginners. Thanks again for watching. Have a great and healthier you. Bye!